The Chiron Project. Peter is 70 years old and he lives with his wife in a small village. Since 12 years, he is suffering from congestive heart failure. His doctor explained him that his heart is unable to pump enough blood to meet the needs of the tissues of his body. During the last year, he was hospitalized twice. 6 months ago, Peter's doctor suggested to him to participate on a voluntary basis in the Chiron experimental program. It's based on the use of ICT technology supporting the patient suffering from cardiac diseases. Every morning, Peter measures his weight, the oxygen saturation, and the blood pressure. The data are sent wirelessly to the smartphone and then to the PC at home. It's 11 o'clock and a message on the smartphone informs Peter that he has to wear the physiological sensors. Let's also introduce Mary. She's Peter's wife. She plays a key role. Continuously, she is watching her husband's health status. Before the starting of this experimental program, she had a short training together with Peter. The sensors used by Peter are wearable. They're very light and when worn, they do not give any annoying trouble to Peter. A chest belt includes an accelerometer, an electrocardiogram module and a sensor for the measurement of the skin temperature and of the sweat index. Novel techniques are employed to combine unobtrusiveness with enough accuracy in the measurements. A thigh strap includes a second accelerometer. The ECG module records Peter's electrocardiogram. The raw signals are sent wirelessly to the smartphone, where a Chiron specifically developed algorithm, the Falcon algorithm, processes them and extracts the data clinically important such as the heart rate and heart rate variability, the ST segment shift, the QRS length, etc. Moreover, an innovative algorithm developed in Chiron allows to derive the value of the blood serum potassium concentration through the analysis of the electrocardiogram. The two accelerometers, one in the chest belt and the second one in the thigh strap, send their signals to the smartphone where the physical activities done by Peter are recognized. Standing, walking, running, sitting, lying, kneeling, transitions between these activities. By combining the activity information with the cardiac measurements, an algorithm is calculating the energy expenditure index. All the monitored data are very important to characterize the health status of the patient and to timely detect the occurrence of degenerative trends. All the new collective data are uploaded in Peter's health profile. Last evening, before going to sleep, Peter removed his sensors and connected them to the battery charger. Peter is wearing his sensors. The smartphone recognizes that the chest belt was worn incorrectly and sends a message to Peter. He corrects the position of the belt and the smartphone confirms that now everything is okay. The physiological sensors worn by Peter are not the only sensors used in Chiron. There is also an integrated environmental sensor measuring the indoor temperature and humidity. The Chiron wearable multisensorial platform allows the monitoring of the physiological parameters also when Peter is outside home. The data are transferred from the sensors to the smartphone and from the smartphone to the remote medical center. Let's now introduce Dr. Robinson, the family doctor of Peter. The Chiron system allows him to assess the data via internet and to have a clear understanding of the status of his patients. He sees on the screen of the PC each one of his patients with a frame of different color. Green if the situation is satisfactory, yellow if there are some parameters asking for attention, and red in the case of a critical degeneration of the health conditions. In case of the sudden occurrence of a critical degenerative episode, the system automatically activates an alarm mechanism and advises Dr. Robinson and directly the Emergency Health Service if the situation is very serious and urgent. He can see all the monitored parameters of Peter and, what is more important, he can observe their trends during the last monitored weeks. The Chiron system elaborates and keeps up to date the personalized risk profile of Peter. This is done by the Chiron MEST system, the medical expert system tool, which takes into account all the available data related to the patient, including his medical profile and clinical history. Each patient is unique, and the Chiron system allows to prescribe for each of the patients which parameters have to be monitored, how much time, and how long during the day. If needed, Dr. Robinson can change the therapeutic program accordingly and eventually plan an earlier visit to Peter or to prescribe him some new laboratory analyses by sending him a message. Dr. Robinson explains the additional support he is receiving from the Chiron system. As an example, he can easily search for literature related to interesting clinical cases. This support is provided by the Chiron Literature Search tool. It is enough to write a keyboard in the search box, and he will have a list of papers published in important medical journals and download what he feels more interesting. The Chiron system is fostering a continuum of care and is providing innovative solutions also for the hospital. Let's describe you some of them. We are with Dr. Ross, Director of the Imaging Department of the Cardiac Division. Dr. Ross explains some of the new solutions used at the hospital and provided by Chiron. Through Chiron, doctors can have access to a massive quantity of data related to their patient, the parameters monitored at home, the clinical data available at the hospital and related to previous exams, the prescribed therapeutic plans, and the hospitalizations of the patient. All the data are gathered from different sources, and all of them form a kind of virtual data repository. The integration and the interoperability of the various data are made possible through the use of standards such as the HL7 standard. Other important advances introduced by Chiron are in the imaging area. Among them, a new solution of computer-aided detection using 3D echocardio images and allowing to map the elasticity of the cardiac tissue. A CAD solution using magnetic resonance images of the heart for the automatic search, localization and measurement of scar. A new display using 2 LCD layers featuring very high contrast, very deep black level and high dynamic range. A new personalized calibration methodology for medical displays. A quality assurance web mobile module allowing the calibration and the use of an iPad for viewing medical images. The Chiron Project promises to change the way how healthcare services are delivered to the citizens. Chiron is the result of the research work of 27 partners located in 8 European countries. Chiron is a project co-financed by the Artemis Joint Undertaking and by the national governments of these 8 countries.